And now we are joined by the fabulous Dr. Barbra Krantz. Hi, I'm Jessica.
Hi, Jessica. How do you do?
Nice to see you today. And you are the medical director of the Hanley Center, and that's a drug treatment center in Florida.
Yes, it is.
And so there's this disturbing trend going on, and you can probably talk about it much better than I can, but more and more people are having these accidental overdoses from prescription drugs.
That's correct. Prescription drug overdose today nationally is the second leading cause of unintentional injury death in the United States.
That is so surprising to me. Why do you think that it's increased so much?
Well, I think it's a combination of factors. There was the paradigm shift in treating pain by physicians in the late 1990s. That came down as a joint commission mandate to use pain as the fifth vital sign. And then there's direct consumer advertising, so the consumers, the public, are more aware of the medications that are out there. And then you started seeing the baby boomers, starting to that quick fix mentality. I have a pain, weekend warriors, I'm going to treat it with a drug. Better living through better chemistry.
So how many people are we talking about?
Oh, we're talking about serious numbers. When you look at the national statistics, in 2008, there were 7,000 people a year that started using and abusing prescription drugs. 7,000 a day, actually, a day in that year.
7,000 a day?
Yes.
Wow. And so we were talking about Rick and I before that, when we think of accidental overdose, I always think of celebrities. Heath Ledger immediately comes to mind, but that's not the typical patient or the typical person that this is happening to, right?
No, the typical person is actually in the age range of like 35 to 64, which includes the baby boomers. And they are, they're educated. It's not the street junkie that you're talking about. I mean, it's an educated person that is looking for pain relief and is looking to, again, that quick fix to take care of every ache or pain. So people are dying every day from this disease.
So, I mean, you think prescription drugs safe or safer? It's not, a street drug. So how do you know if you're, at danger yourself or someone is, abusing prescription drugs?
And see, that's exactly the problem. When people talk about prescription drugs, their perception is that it's safe. Well, they're just as addicting as any other drug. So what'll happen, and most of the patients that are getting the prescription drugs are actually getting it from one doctor, or they're getting it from friends or family, because people don't throw out their prescription drugs, let's say, after a surgery. So there's ready access to it. And people are abusing in numbers that we've never seen before. We've had a 70% increase in 2 years at the Hanley Center. It is crazy. It's sad because it's legal. I mean, people are dying. In Palm Beach County, Florida, where I come from, there's one death every 24 hours from prescription drug overdose. That's more than homicide, suicide, or motor vehicle accidents.
And who is to blame? Doctors are prescribing these drugs, and then there is our society is like, let's take a pill to fix everything. I mean, who's at fault?
Well, it's a combination, and I think the solution is going to be a combination. I think we need to do exactly what you're doing today, get the message out. This is a public health crisis. Prescription drugs are not safe. Let's look at your use of prescription drugs. Is it for acute pain? When you start dealing with chronic pain, there may be other alternatives that you can use. The physicians need education about dispensing. They don't ask the right questions if a patient has a history of drug or alcohol dependence in their family. So the physicians need education. Big Pharma has enough medications out there available for treating cancer pain, malignant pain. We need to be much more judicious in our prescribing our pain medication.
And once again, how do you know if you're addicted? How do you know?
Well, sometimes the person is the last one that knows. I think in their heart that they know that there's a problem. But when you see yourself taking more of the drug than's prescribed, or taking it more frequently or higher dosages, or if you see that you're taking it and your pain really is gone, but that euphoria that you felt, you thought, oh, well, I feel kind of bad today. I think I'll just take a pill. Those are red flags right there. And of course, if you have a family history. But what will happen is that a progressive isolation will happen in your life. There's a downward spiral that occurs. And by then, usually the patient is aware of it. But the family is important in an intervention.
Yeah, what do you do? What do you do in a situation like that?
Well, if you have a family member or loved one that you know is abusing their prescription drugs, you can go to hanleycenter.org. We have a wealth of information on our website. You can go to your primary care physician. You can go to interventionists that are out there that can actually help the person understand that this is not a safe drug and it's just as addictive as cocaine or heroin.
And that it can be lethal.
It is lethal. That's what we're seeing today. That's my concern. That's why I called it Pharmageddon. People are dying every day from prescription drug overdose, unintentional deaths.
Thank you so much, Barbara, for coming here and raising this awareness. We really appreciate it.
You're welcome.
Great seeing you. Yes, thank you.
All right.